You want to go off mute, please?
Great. Great. Good morning, good evening to everyone, wherever you are. I'm here to present you some interim results on a survey that we sent out just to get feedback from the AP focal persons plus other MOH officials regarding hepatitis B birth dose vaccination in Africa. Just to mention that this is an effort for us as the coalition to build this community of practice whereby we have all this information that countries can use to help them when it comes to the introduction and the strengthening of birth dose. So the objectives of this survey were to identify countries with and describe their hepatitis B birth dose policies. We're also interested in identifying countries with NITAGs and those that had NITAGs, whether they had discussed about hepatitis B birth dose introduction. We also wanted to identify countries that plan or have actually conducted serosurveillance for hepatitis B among children. We also wanted to identify countries, technical support partners, just to be able to know who is working in their respective countries. We wanted to describe challenges faced by countries with respect to birth dose introduction, as well as the scale up of the vaccine coverage. Just to mention, we reached out to API managers plus other hepatitis B focal persons working in the ministry to complete this survey. And to this date, and I encourage more who are in this particular audience to continue filling this survey, because the more comprehensive data that we have, the better to have this knowledge base. So we have countries as listed in the slide that responded to this particular survey. And if your country is not in this, I would encourage you to go ahead and fill this survey. Of course, the links for this survey will be provided in the chat box and also available on the emails that you receive invitations to this meeting. We identified 4 countries that have, based on the feedback that we got from this survey, 4 countries have a birth dose policy. 3 of them have a universal birth dose for all babies. And 1 country, Burkina Faso, reported that they have, yes, a birth dose policy, but only for babies born to hepatitis B surface antigen positive women. Among the countries that did not have a birth dose policies, 7 countries reported that they plan to introduce hepatitis B birth dose vaccination. And out of these 7, only 3 have included this agenda in their comprehensive multi-year strategic plan. Among countries that have NITAGs, just to report, there are about 9 of them who responded to this survey that say that they have NITAGs. And amongst those 9, 5 reported that they have discussed birth dose introduction. And 3 of those 5 have recommended birth dose introduction. The 2 countries without NITAGs include Chad and Namibia, as reported to us. 5 countries planned to conduct serosurveillance amongst children, as based on the report that we got. They have either planned to or have actually conducted serosurveillance among children. 8 countries, the EPIs or the persons who responded to the survey, in 8 countries, the APIs were aware of the WHO global targets for hepatitis elimination by 2030. 3 countries reported that they have EPI technical partners working for them. Again, this is based on the feedback that we got from this particular survey. And of course, probably the others that might not have been known to the persons who responded to this survey. Amongst the challenges that that MOH people face in terms of introduction of hepatitis B birth dose. The leading ones included amongst the policy, financing and funds for vaccine introduction. 7 countries reported they have that difficulty. Lack of national policy in 4 countries. In terms of programmatic challenges, there were challenges with data systems to monitor and evaluate programs, as well as API program collaborating with maternal child health. And they report that they have challenges with training clinicians on that. In terms of community and cultural challenges, home births were the leading challenges that were identified by these countries. Other challenges include the competing interests associated with COVID-19 plus other diseases like polio, the limited human resource capacity, lack of support by immunization technical advisory groups, the NITAGs, as well as vaccine not being available in some of these countries. Other comments that were reported to us is that, for example, in Central Africa Republic, they started a vaccination control program in 2019. However, till today, no much activity has gone on, although they do have plans to prioritize the introduction of hepatitis B birth dose this year. In Chad, they hope to integrate hepatitis B virus with, prevention of mother-to-child transmission with HIV services in order to achieve the 2030 elimination goals. In Ghana, they reported that CDC hepatitis B serosurveillance study among pregnant women is in advanced stages and is key in getting NITAGs to consider the introduction, to recommend the introduction of hepatitis B birth dose. In Mozambique, they reported that they have challenges with funding, and Namibia reported that they need capacity to build healthcare workers. They need capacity building for healthcare workers, as well as especially for the new staff that get to do these activities. In South Africa, COVID-19 has actually delayed the implementation of hepatitis B birth dose. And in South Sudan, they noted that there's low coverage of routine vaccines due to systemic issues, like poor health infrastructure, inadequate human resources, and as well as a lack of funds. So as again, just to emphasize, I will really appreciate if your country is not represented in this survey, or you have more information regarding your country, it will be nice for you to respond to this particular survey that can be found in the link as shown in the slide, and also will be available in the charts that are in this particular webinar series. Thank you very much.
Thank you very much, Henry. And please do participate in the survey so we can get a better understanding. It'll be the type of information that's being requested by Gavi as just one example. But we do have one hand up. I wanted to call on Dr. Marcello to be on for comments. Marcel?
Sorry, I have raised that hand when we were discussing about the data. So I think we can just ignore it. So
okay.
Thank you.
I apologize. I did not see that until now. So apologies. So again, thank you, Henry. And again, we're going to be using this information to begin to develop the agenda for webinar number 2, where we're really going to begin to focus on the different implementation issues at the country level and really have the EPI managers take